This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
I am able to practice medicine on my own terms, and I don't have to follow the insurance rules to do what's right for my patients. I get to help them on a more personal level and not treat them as an assembly line. I go to work every day enjoying what I do now. The business aspect is harder than I thought it would be. However, my patient interactions are so much more rewarding now. I am Dr. Jeffrey Shookman, and this is my DPC story.
Dr. Jeffrey Shookman is an osteopathic physician who is board certified in internal medicine and obesity medicine. He is a leading direct primary care physician in Los Angeles County for weight loss, wellness, and ongoing primary care. He's led an active lifestyle from a young age. Dr. Shookman is passionate about the role of sports, fitness, and positive lifestyle choices as the foundation of lifelong health and wellness. He started playing ice hockey at just 4 years old. His love of sports continued throughout his adult life, where he hopes to pass on his enthusiasm for fitness and fun to his 2 young boys. Of course, Dr. Shookman knows leading a healthy lifestyle isn't always a linear path. At age 16, he was involved in a car accident with an 18-wheeler truck. The setback and subsequent recovery took him off the ice and into the world of medicine, where he discovered his drive for empowering wellness. Welcome to the podcast, Dr. Shookman.
Thank you. Thank you so much for having me.
We are on California time. You are located in SoCal, and I hope to be able to meet you later this year at one of the SoCal events. So one of the things that really stuck out when you had put your information in to be on the podcast was that you had this experience of being a survivor of a car accident, and it just gave me chills. I've mentioned it in part in the past and on the podcast, but my dad, when I was 16, was hit by an 18-wheeler, and it changed his life completely. And so for you, in your bio, you mentioned how being in a car accident really affected you to a level that you had never been affected before. You were taken off the ice and you were thrown into the world of medicine, not by your choice. So can you tell us about how getting through being hit by an 18-wheeler affected your trajectory in your professional life?
Yeah, definitely. It was kind of that moment in your life that you kind of take a look back at everything you've been doing, and you have to decide at that point, am I going to let this defeat me, or am I going to kind of try and change the trajectory of my life? And, growing up, I always loved sports and I loved hockey. And, that's all I really saw in front of me. And I thought I was going to go all the way with that. And, here comes kind of this life-altering event. And I have, my mom's a nurse, and so I have a lot of kind of background. My grandma was a veterinarian, and so a lot of kind of medical background. I always enjoyed sports and the medicine aspect of it. But yeah, it really knocked me off my feet, and I decided at that moment when basically the doctor said he didn't know if I was going to walk again, that I had to make that decision at that point that, hey, hockey's not going to be my career. And so from then on, all the things I learned in hockey and the dedication and the failing and all those kind of tools you learned through team sports, I applied it towards my studies, and I said, hey, I'm not going to let this defeat me, and I'm going to buckle down and get more serious about my studies, and soon learned about what osteopathy was when I was in college. And I always knew I wanted to do something in the medical field. But when I learned about the osteopathic physicians and what they can do and kind of the musculoskeletal aspect along with being a physician, I thought was incredible. And yeah, it put me on that trajectory of being a DO. I love what I do now.
It's awesome. And just taking a step back and listening to what you're saying, it also does not surprise me that you are one of the thousands of us who have chosen to do DPC rather than sticking with the fee for service world. And we're going to hear a little bit more about your journey before DPC, but just this idea of you had the skills, you had the mental preparation to be a survivor and to thrive no matter what happened. And like you mentioned in your bio, you have two young boys to become who are impressionable. And so this is really awesome, not only because you probably bring this type of mentality to frustrations they may go through, but also it's awesome that you were able to pull from your experience and the skills that you learned and harnessed and honed in on during that experience to leave corporate medicine and choose direct primary care. So there I want to ask about once you saw how awesome osteopathy was, you earned your DO, you went from residency into corporate medicine. So can you tell us about that journey? And this is very interesting because we just heard from Dr. Jamie Eller a few podcasts ago, who was very frustrated because she was a family doctor who wanted to do osteopathy as well as family medicine, but she became the osteopathic specialist and didn't even see kids for a year and a half. So for you, what was your journey in corporate medicine like? And were you able to do osteopathy as well as other things in your role in corporate?
Yeah, absolutely. So I went to an MD residency, but I knew I wanted to come to LA. And so I did my residency at Cedars-Sinai. And so I didn't really get to kind of practice my osteopathy there either. And I knew that I would always come back to it eventually. And I would treat my family all the time when I had the time. And so I kept my skills up doing it that way. But as I got out, my wife and I had a kid already, and so we knew that we can't go out on our own and open up our own practice right away. We needed to make some money, especially living in LA. It was just so expensive, but we definitely wanted to get our life started, and so that's where I found the corporate practice that I joined. And when I did join, it was kind of a physician-owned group, but they were already kind of in affiliation with a bigger organization at that point. And basically, that initial kind of feeling where they were like, you get to do what you want, you can practice how you want to do it. But quickly you realize, hey, I don't have the time to do what I need to do. And so it's, yeah, you can do whatever you want, but you have to kind of fit yourself into this schedule. And it was impossible. So whenever I did want to do any kind of osteopathic manipulation, it was on top of patients complaining of 20 other different problems. You had maybe 5 minutes to spend with them. So to do osteopathy in that 5 minute period is close to impossible. So there was sometimes very low hanging fruit where I can use my skills on those patients, but it was very few and far in between. And I was working in that corporate practice for about 8 years, and I started to realized the medicine aspect of it was I was not practicing the way I wanted to, but I loved the group that I was in. I loved the physicians I worked with. And I felt that I wanted to make that organization better. And I actually started working up that organization as a UM medical director, which is funny because it's insurance, because the company needed my help. And then I also got onto the board right at the end thinking, hey, I'm going to try and make a difference and try and make this corporate model work. And quickly realized that the ship has sailed and there's no changing the corporate model. It's only going to keep getting worse. And yeah, at that point, I had no clue what DPC was. I don't even remember how it came up. I think, and then I started listening to your podcast, and it really just opened my eyes to seeing happy doctors. And I realized I was not happy practicing medicine. I was trying to do all this administrative stuff and try to change this model that's been ingrained in kind of how we do things these days in the corporate model, and realize that, hey, I got to make this decision now. Like either I continue on this road and I'm on the board and all this stuff, or I just enjoy practicing medicine and go into it for what I want to. Don't kind of take the reins of my own life and practice medicine that I want to, the way I want to do it, rather than just letting other people feeling guilty and all these things about trying to help the bigger population when I felt like I wasn't really doing justice to my patients in the way that I was practicing. And the more that I'm out now, I start to realize how I was in a way controlled by the system and the way that I was prescribing and the way that I was educating. All these metrics, they kind of force you and pigeonhole you into practicing a certain way, which is not a lifestyle type of way. It's a very medication heavy type of practice. So yeah, so I think I learned a lot. I'm very grateful for those 8 years. It made me kind of the doc that I am today, and build the confidence. And I continue to feel for all my colleagues out there who I think are doing their best in the system that they're in. But I hope that this will be kind of a good answer for a lot more of my colleagues to practice medicine the way they want to, and also hopefully improve the quality of healthcare.
And you called it, right? Like you said that in your opening statement that you didn't want to function as an assembly line worker anymore. And it
Yeah,
totally is. I
absolutely.
mean, like you listen to what you just said, and it's like the way that it's done is there's great examples in California, especially where it's like of the medicines we have to control hypertension, you can only choose from these three.
Mhm.
That doesn't matter if these are the best three. That's the ones that the PBMs have worked with us to get a discount on. And there might be a kickback on if we prescribe enough of them. And so these are the three that you will choose from. And this is the amount of time that you have to be with a patient. And if you do not, we will put in those reprimands to make you feel like it's your fault that you're not working fast enough, that you're doing something, that it is not the system's problem, it is your problem. I mean, it's totally assembly line worker stuff. And this is where that terminology, it is so sad that we as doctors were not prepared, I feel, for you are, especially like people who graduated in like before out of medical school before 2020, we're not prepared for this is the reality of the business of medicine. When you leave medical school, it is not about how you want to practice. It is what is the model that you are practicing in and how do they develop their assembly line. So for you, one of the things that I noted when you had put in to be on the podcast was that you rated your burnout a 9 out of 10. And so I think a couple of things. One, I just met with a husband and wife team who one's in administration and one is doing her thing as a family medicine doctor. And it made me think about hearing their journey and hearing what you said about how you tried to make things better at corporate, which is not an unheard of situation from guests on this podcast. But do you think that you reached that 9 out of 10 level burnout when you were when you were the doctor who was, trying to do his best in practice? Or do you think that got exacerbated because you were trying to do things in corporate to make a change and you weren't finding that change was happening.
Yeah, absolutely. Yeah, I think that I really I really appreciated my colleagues, and the organization kind of asked me to step up and really help them. I had great patient satisfaction scores. I was always, I'm a type A personality. I have to do things the right way, and I have to answer all my patients' messages like immediately, and so my in basket was always clear. Everything was always like up and running perfectly, and then they would kind of load me up with more stuff and training at my site, and training all these older docs that they acquired who they can't keep up with the system, they can't clear their inbox, they're not tech savvy, and so on top of seeing all my patients, now I'm training these poor docs who can't keep up with this model, and their in baskets have thousands and thousands of overdue tasks, and then they would keep putting the pressure on me to kind of try and control my site and try to kick the horse, and you kind of feel like you're beating that dead horse at one point, where it's, dude, they're doing their best, and they you start to feel like they're treating you just a regular employee, and I felt like the respect for doctors completely was not there anymore. The staff was overworked, and there were shortages constantly. And so everyone's doing their best, and COVID hit, and it was just one thing after the other. And so when I started, they asked me that they needed a medical director, and it was very ironic, but I learned a lot about insurance and these guidelines, and I found myself denying things that I'm like, oh my God, this really should be approved, but because it doesn't fit in this box of this insurance, I have to deny this thing. And yeah, it's crazy that you start to understand how much administration is involved in everything. And we're not really saving any money, I don't think, by, hiring a million of these middlemen people who think they're going to save one CT scan for one patient, which when you learn in DPC, you can get a CT scan for pretty cheap, cash based. And so it's just incredible learning all that stuff about insurance and the guidelines, and so leaving that role, which was very eye-opening for me as well, but I learned quickly that our system is very broken, and yeah, I just knew that I wanted to do it differently, and so I started working from, I was kind of doing 8 to 5, but by the time I would finish all my work, it was closer to 7. And so I wasn't seeing my kids, and my wife was getting pissed off at me, rightfully so, that I don't really spend enough time with the kids. And then I was doing kind of more the administrative role. And then I was working even harder because they there was just a huge volume of referrals that we have to go through. And so even on the days where I was seeing patients, I was helping out doing these reviews of these cases. And so I just found myself working harder and harder and harder, and there was really no benefit. And I kind of felt like this ship is going in the wrong direction. I'm unhappy all the time, and I don't even like how I practice medicine. So I just realized quickly that things are only getting worse and they're not getting better. And I knew that there needs to be some type of change, or I'm going to be fully burnt out to the point where I can't even concentrate anymore because it's just too much stuff. And my kids were getting older, and I wasn't spending enough time with them, and I couldn't dedicate all those hours that I know I wanted to dedicate more to my family rather than just medicine. And yeah, so DPC came along, and I saw that there was another answer for our system, and it saved me.
And one that allows you to really, like you just said, you weren't happy with your way of doing medicine. You are so lifestyle focused. And so there's a model that actually allows you the time that you need to talk to people about, hey, your sleep. And we don't have to talk about it in a 5-minute session. Like we can actually talk about it over multiple sessions. So let me ask you there, how did you transition actively into opening your own practice?
Yeah, so I learned about the DPC. I went to the summit, or the Nuts and Bolts, I should say, conference. And I met Amy Ostick out here, and I sat down with her and I told her kind of, I need to figure something out. I just learned about DPC. I was listening to your podcast, and it was very motivating to hear so many happy doctors. And she reiterated, yeah, these doctors, it is so much better. And she left a corporate model as well. And she just showed me that it's very doable and possible. And she basically just told me, go to the DPC nuts and bolts. And to be honest with you, even before that, I was super scared do the leap, and I almost wasn't going to go to the summit. I almost like completely changed my mind at that point. And then my wife was like, "Look, you're miserable. Just go see what it is. You'll learn, and you'll see if it really is something that you can do." And I went, and it was definitely like that's what pushed me over the edge at that point, is going to that summit and just experiencing that and just seeing all the docs and realizing that it's very doable, and you don't need to know how to do everything business wise. You just kind of have to take the leap, and you kind of have a blueprint. The community was just so supportive, and you can find so much stuff online, and it's not rocket science. You just follow these steps. I had to get comfortable with Instagram and putting my face out there and all these things, but you just do it. You just close your eyes and realize that, hey, this is what's going to get me to a better place and enjoying practicing medicine again. And so when I did all that and I realized that it's not rocket science and I took the leap, then all these things, it's not perfect. I'm constantly learning how to work on the business and not just in the business at this point, which is its own skill that you start to learn, but it's very doable. And I've never been so happy seeing patients this way and being there for them in the way that I am now, rather than my patients would take a month or two to get in with me. Anytime they had an urgent thing, they were in urgent cares, ERs. The scattered care was there, and now I'm like coordinating my patients, inpatient, outpatient. They text me, they call me, I just take care of them as soon as they need me to. They have that reassurance that I'm there for them when they need me. And I really get to enjoy seeing them through these tough times, which before it was like my partners would see them because I didn't have any hospital discharge follow-up of availability, and I was just so burnt out, and so I couldn't even fit in the 10 patients a day that were calling that really wanted just to see me, and so it was just a constant internal turmoil of like I'm not there for my patients. And so now experiencing that to be there for them is just really cool experience in itself, is getting to practice medicine how I think it was practiced probably back in the day, and how it should be practiced now.
It just makes me think about how you mentioned the doctors that were older and having issues with adjusting to the new technology, EMR demands, et cetera, because they were used to practicing personalized medicine. It is so sad when you talk with someone who practiced before, maybe not before Nixon and HMOs, but who was at the time when the world was not as crazy as it is, filled with admins and administrative burdens on the doctors like it is now. When you talk with these people and they're like, yeah, this whole coding business, it was like, I speak, the person who is characterizing the doctor who I speak of and who you're speaking of is the doctor who trained us in Nebraska, when he was saying to me, like, these code things happen. And like, we thought it was great because we thought we would be doing less billing. And it
Mhm.
turned out that it was like the Trojan horse. Like, this was not at all the system that we signed up to do or to be a part of. And so for you being able to go to that way of medicine, it's amazing. And you're going to be approaching your first anniversary, which early congratulations is awesome. So
Thank you.
especially with you being in the thick of the first year, because we have stories all over the podcast from people like Dr. Kissy Blackwell opened with over 270 patients, and people who, like Dr. Erin Harris, had 5 patients over multiple years until her practice like blew up and grew like crazy. So in this mindset of the first year, talk to us about your financial planning and how after nuts and bolts you deployed like where to put your dollars in terms of investing in building, in terms of investing in staff, in terms of investing in paying yourself. How did you go from being an employed physician to choosing where your dollars went, especially because you are in this first year? Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yeah, I think I knew that leaving, I'm going to need a grind. So I was doing house calls and all kinds of stuff. And luckily, I found some other physicians who are in private practice who kind of gave me opportunities to just make money on the side. And I continue to do those things. And which is why I never got rid of Medicare. I knew that I wanted to keep Medicare as an option. And then the lawyer I met with, she was very much like, why would you get rid of Medicare? You can kind of just do the concierge model basically for Medicare. And so I figured, yeah, you're right. So I'll just have a biller for that reason. And that's all I did. So I am doing the kind of the hybrid model right now. But yeah, Tuesdays and Thursdays, basically, I'm hustling on the side, doing my side gigs. And I knew that if I need to fit in a patient, I have the flexibility to be like, yeah, Tuesday and Thursday, I'll shove someone in if I need to. And I'm kind of always available via phone. And the technology these days makes it almost so easy to kind of be anywhere and treat people from wherever you are, that it's very convenient. And then Monday, Wednesday, Fridays, I'm in clinic seeing patients, and you start to look at the finances and you kind of think about like, how many patients do I need in order to sustain my life and also control my panels and do all these things to a point that makes sense for me. And that's kind of how I figured everything out, and it's always a work in progress. And what I thought originally I was going to do is very different than what I'm doing now, and it's constantly evolving. And so this first year has been really, there's been a lot of kind of ups and downs, I will say, and it's definitely not easy. And you start to realize quickly I need to work on my business a lot, and some of that takes a lot of your time too. So and so separating. Sometimes you're working even harder because even when you are with your family, your brain is, oh my God, what should I need to be? You start thinking about the business side of things and like, oh, maybe I'll offer this, or I'll offer that, or I'll do this package or that package. And you're just kind of creating things in your head. But it's fun too, because you're just very creative and you can think what brings the most value to your patients. But on the other hand, it also takes a lot of time and mental effort to do those things. The clinical side is almost really easy at this point, and you just get to have fun seeing patients. But the business side is now the hard side of that coin. But I start to realize that, hey, I still have so much more time now, and I'm enjoying what I do. And the financial piece, luckily, my wife's also a physician, and we're pretty stable at this point with our finances. And so now we're just creating more of the life we want rather than just being focused on the financial aspect, which will come as long as you're given the value that people are looking for. And so I think that you get to be just really creative now in how you practice.
You talked about your side gigs. You talked about like finances. Your wife's helping out also in terms of how you chose to divvy up those finances in your space, in staff, in paying yourself. How are you doing that right now in the first year?
Yeah, absolutely. So from the get-go, I came kind of from this corporate practice, and so I also had to do a mindset shift, but I had an MA, we had phlebotomy, we had everything in house, we had X-ray, and we had all the bells and whistles of kind of like this convenience. But I realized quickly there's so many community facilities and ways to do things that patients are not like, oh, I have to have phlebotomy on site or whatever. But I did know that I didn't want to, I wanted to have an MA, but I've been through three now, so and I have to keep training them. So honestly, the hiring has been the hardest part, and now I'm at a point where I'm doing my own blood draws, and it's not as hard as you think it would be. And so I just realized that I can do this stuff a lot better than my MAs, but I also have there's time value money kind of situation going on. But so after my third MA, I realized I'm just going to have a receptionist now. So I'm in the process of just hiring a receptionist. I was trying to pay a lot, and even then, for some reason, this workforce is very different, and a lot of people just don't want to work. I don't know what it is right now, and it's through. It's not even in just medicine. I talk to other business owners, and everyone has the same problem right now, and I think it's a generational thing. But it's really hard to find good help. But I really wanted an MA to room and do phlebotomy and all this stuff, and then also understand DPC and sell my practice and not always be answering every call and explaining to every single patient what DPC is. And so I realized that I'd rather have a good front person who I can teach what DPC is, who can sell the DPC model to people, explain it to them, and so I'm kind of taking the pivot now of just having more of a front staff. And then I have this virtual medical assistant who is amazing, who does like all these prior auths and answers phone calls. Like it's really she's been amazing in my practice and works 10 times harder for way cheaper than anyone that you can hire here, which is very sad. But the overseas kind of help that we've gotten has been just life changing for me. I was already paying a good amount for my medical assistant, and I'm like, oh my God, I have another expense. But when my medical assistant would call out or go on vacation, and they call out all the time, I just realized I can't do everything. I can't be doing my side gig, answering the phone calls, so explaining what DPC is, and all this stuff, and it was too much for me to juggle. So for me, it was I made the decision to hire on the help. And then I wanted to keep my overhead as low as possible, but I've learned that certain areas and Woodland Hills is kind of like slightly cheaper than some of the other areas, and it was close to home. So I found an office that was really close to me and just opened up a small office and tried to keep my overhead low and did all my side gigs to kind of I knew that once I would do it. I've been here for 8 years, and so a lot of my patients are going to find me, and they did, and word of mouth and all this stuff has been probably the biggest growth pattern for me is through word of mouth. The patients who do join my practice, it sells itself very quickly, and then they're so happy, and then they're telling all their friends, and so I've noticed that that's been the easiest way to grow. I have spent money on advertising and all these things, which I realized quickly you can spend a ton on advertising and it will get you not much bang for your buck. And DPC is a tough sell, and that's why I love what you're doing. I think that, um, especially out here, there's so much concierge, and people don't really realize how DPC can potentially save them money and how this model is just 10 times better, in my opinion, than concierge model. And it's a kind of a win-win for the docs and a win for the patients. And explaining that and it's almost like the concierge style is so much it grows so much faster because of the way that everyone's ingrained with their insurance and think that they should be using their insurance for everything. It's kind of interesting the psychology behind it all, but I think that yeah, that's I just knew I didn't want to run the practice by myself. Quality of life was really important for me, and I decided to have kind of that upfront costs to be a little bit higher with hiring help rather than just doing it all on my own.
And that's the thing I love also about DPC is that you can literally personalize your clinic to the level of how are you going to be involved in your clinic, your own clinic? How are you going to be working on the business versus working in the business? Are you going to have help? If you're going to have help, who's going to help you? Your family, virtual assistant, in person. It's literally, there is no algorithm. Literally, there is the opposite of what assembly line you came from. And so I think that it also, and I don't know if you agree with this, but it also, as we hear people talking about, like Dr. Naz Mohammed, he said, I work 4 times harder, but it's not the same level of work. It's not the same. I want to bang my head against the wall if I have to do one more Medicare physical. And you might still do that just because of taking insurance, but it's like, I remember sitting in absolute misery. What am I doing with my life? Asking people if they wear their goddamn seatbelt. Not even, and then
Right.
I would say to them, this is the exam where I'm not supposed to touch you or listen to you. And they're like, what do you mean? But this is my physical. I'm like, would you like to see? And I would pull it up on my phone. This is not the exam where you are to touch or to listen to people. And they would be like, what?
Exactly.
Yeah, it's crazy. It just makes me think about how the level of work that we are putting in. Absolutely, I agree with you. It's crazy hard sometimes, but the
Yeah, it's much more enjoyable.
yeah,
Yeah, and what I tell my patients, like, if you want 10 physicals a year, we can do 10 physicals a year. Like, you can have as many physicals as you want. It's just, you're just labeling preventative care as a physical. I'm doing preventative care every day. It doesn't have to be labeled as some type of physical. And with Medicare, like, I don't rely on that income. I don't think of that extra income as, so I just do what I know needs to happen. And with Medicare, they don't cover a vitamin D or whatever. It's like, all right, here's a $5 vitamin D test. I don't have to focus on the coding as much because it's it's all about just seeing the patients, doing what's right for them, and not labeling it as a physical, or I have to, before it's like you're always thinking about how am I going to code this? How many minutes did I spend with the patient? Am I going to go by a level 4 or level 5 or level 3? It's like, why does the physician have to think about any of that? It should just be like, let me just do what's right, what I think is right for this patient at that moment, and not think about the coding behind it all. And so it just frees you from the nonsense of what the system is forcing us to do, and coming back to just let me do what's right for my patient.
stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. Absolutely. So let me ask you there, when you, like you mentioned how you still take Medicare, you have a biller for Medicare. Did you bring on staff as you had patients to fund the staff? I mean, clearly you have your side gig income and you have your wife's income, but in terms of like you, just to get into the details of your staff, you have a team that includes nutritionists, a fitness trainer, psychologist, and an aesthetic nurse. So how did you financially work to bring all of these teammates on to your practice?
Yeah, so the only employee I have is my medical assistant. Everything else is just, you just consult with people who are good. And I brought them onto the team and I explained to them the model. And I don't really make money off of my consultants in any way. They give my patients discounts so that my members get a benefit, and I give them these awesome connections with better rates for them. And it benefits my practice because my patients get really cool consultants and better care. My consultants love it because they get cash-based referrals. And so it's kind of a win-win all around. And we just basically just take a little bit for advertising and those kind of things for the consultants and stuff. But yeah, you get to structure it however you want. And I realize that I just keep my overhead low because I have people approaching me all the time and they're like, hey, I'd love to be like a consultant for you in this way or that way. And one person even wanted me to hire them. I'm like, no, I'm not going to hire you. I can't afford that. But if you want, I'm happy to kind of promote you to my clinic. But you have to kind of prove yourself that I get to choose who's good quality and not. And so everyone that I bring on, I've either personally had experience with them, and I know that they're excellent at what they do, or they've been through referrals and those kind of things. And so, and yeah, I'm obesity certified, and I learned so much through that program. And so I that's been a tough thing to kind of come up with, as well as what is my weight loss program going to be like, and that's been evolving every day. But yeah, I've helped so many people already lose weight, a lot of people naturally, um, doing things alternatively and really focusing on lifestyle, more medicine rather than just prescribing medications all the time. And so, yeah, with my aesthetic person, she approached me too, and she had a great background and she had all this experience at a med spa, and I knew that I my vision of my practice is kind of hitting everything. I think aesthetics is a cool part of medicine as well, and Botox and all these things are medical treatments, and helping people feel younger and look younger, and all this stuff is as mentally important as it is for the physical well-being of them. And so I always knew that I wanted to have the aesthetic portion of it for my patients. And again, they get great deals when they join the membership. So it all funnels into the membership. The goal is to build my panel and give them as much value from my practice as I can get to them.
And I think it's very innovative because it might be common in other professions, but I have not heard that commonly on this podcast from guests to work with people, but brand as one team, even though these people are consultants. There are some cases, but I don't think that this is very common. So, especially with the changes in the 1099s and W-2s, where 1099s are going to be very, very strict for us to be able to hire other physicians as a model to bring them on, which is the most common way that people are bringing people on to their practice. Doing what you are doing is very innovative. And so,
Absolutely.
yeah. And
Yeah,
so
and I promote them, and they all have their own private practices pretty much, and so, but there is all these rules and regulations, and it's kind of crazy, especially in California. It is insane, and you don't want to overstep anything, but you also want to grow and do things what you think is awesome for your patients. So, but yeah, it is a fine balance.
I wanted to talk about branding there because with you having a very clean website with everybody on your team listed, I couldn't make the implication that these people were consultants versus on staff members. It's just they're part of the team on your about page. So when you were coming up with your branding, the name of your practice is White Olive Direct Primary Care. And so can you talk to us first about how you even came up with the name and the branding in terms of the aesthetics of your website, of your brand when you opened?
Yeah, absolutely. So yeah, I was kind of racking through with my wife of different names, and so we named White Olive after my kids. So we were looking at Latin meanings and whatnot, and my younger son is Lucas, and it's white or light, and Oliver for Oliver. And then I looked up white olive, and I saw that, oh, it's a rare olive. And then getting to the root of the problem, and then Mediterranean diet. So all this stuff kind of like had multiple meanings, and that's kind of how we came up with the name, mostly after our kids. And then yeah, with the branding and everything, we worked with Alexa, and she's been amazing. She did our website, and we did it through Wix, and she really did a great job with the colors and all that stuff. So we hired help definitely for all these things. And then once once the Wix was up, and at that point we learned kind of on our own how to then update and use the same kind of structure that was already created to then add on whatever we wanted to. So it's cool that she allowed us to just own our website, and she kind of laid the foundation, and then we were able to take it from there and expand it and add whatever services we wanted to that. And that being said, too, with all the services, you get to offer whatever services you want. And I never thought I'd be into IVs and PRP and regenerative medicine and all this stuff, but you get to just be creative and you get to decide what makes sense. Do I have to do everything evidence-based, which we learned very quickly what evidence-based means. It's big pharma is what evidence-based really is. And so I started to understand that there's so many alternative things that help people feel so much better, that make a lot of sense, that we should be kind of doing more of.
Now, I want to ask about I want to ask about your patients because yes, you had been in the area for quite some time. Yes, your name is not like Smith, so people could look you up and Google where are you. But in terms of when your patients were finding you on day one, what was day one like for you? Did you have a wait list of people who were like, "Hey, let me know," and I'm like, "Here's my membership. I want to be a member."
Yeah, absolutely. So no, I didn't really have a wait list, and the corporate side was a lot of patients were tech messaging me through the portal. Oh, I got the yeah. I was very scared about kind of promoting myself as I was working for that corporate model. And so what I did was I just had my own Instagram thing that I started up, and allowed patients to find me as easy as possible. So I really, right when I left, I tried to get my Google thing going and really promote my SEO stuff, and only now is it even really easier to find me. It's still very it was a while before the SEO, I think it was even kicking in, and everyone was kind of drawn to my old practice, and then I had my old, but when my patients want to find me, they found me. They found my social media stuff, and so the ones that did find me are like the ones that are super dedicated to me, who are like, no, I'm gonna follow you wherever you end up going. And so it's been amazing, and they continue to promote me, and I have some just great patients who have been awesome in my practice. But yeah, in the beginning, I knew that I'm gonna just focus on my side gig and then really focus on structuring. And I didn't want to grow too fast either, because you need to get all the nuts and bolts up and running. You don't want to have 20 patients your first day and be like, oh my God, I don't have an EKG machine. That's you start to realize what supplies you need, and you start to just like slowly ease into it. And you realize you don't have to have everything either. Practicing medicine is pretty, as long as you have a blood pressure cuff and a stethoscope and a little pulse ox, you realize how you don't really need much to be a doc. You just need your prescription pad, you need your mind and your knowledge, and that's all it really takes. And then the little things, if you don't have something, you figure it out. You call up a friend, or you order something, or you try to. And I'm always shopping around for good deals for my patients too. So it's just in DPC, it's cool that you're always cost conscious for them, and you're getting them as much value out of their membership as possible.
And if you live in a place like Woodland Hills, you can get same day delivery from certain services. So
Yeah.
yeah, I'm super jealous from rural America saying that, but I totally have had situations where if I need something that day, it's thank gosh for same day delivery.
Yeah, Amazon is ridiculous. Yeah, it's so easy, but you can find stuff, and yeah, it's amazing how fast things can get delivered.
So now that you're approaching your 1 year anniversary, you have over 100 patients and you opened August of 2023. So tell us about how you ramped up. Did you have, I mean, there's people who left amazing testimonials even from out of state on your website. So did you have people, because you said intentionally you didn't want to grow fast, but how did you see the growth over the months?
Yeah, absolutely. I would say it comes in waves. There's months where it's very slow, and those months I'm just concentrating on improving what I'm offering at that moment and thinking of creative ways to make things better. And then all of a sudden you'll get a wave of another 5, 6 patients or whatnot. But we definitely at one point we're like, oh my God, we should advertise more. And also building the practice how you because what's the what does that avatar patient look like? And I realized quickly that I've got almost like too many businesses in one business going on right now. And it's what type of patient do I really want in my practice? And I started to realize that I just need to advertise and be true to who I am, and the patients that see my model and want to find me are going to. And so I always like that saying of you've met one DPC, you've met one DPC, because how I practice medicine is so different than how anyone else, and that's how it should be. My patients find me and like me for I think for who I am and how I practice rather than just, oh, it's another doctor that I see in some it doesn't matter who I see, they're all going to practice the same way. But here it's no, every single DPC practices very differently, and what we offer is very different. And we have to work that much harder and promote ourselves that much more because it keeps us on our toes because it's like, hey, if another DPC opens up next to me, which I hope they do, and I hope it continues to grow. That just keeps me on my toes. It means I see what they're offering, and I'm like, okay, this is cool. Is that something I want to be having my practice? But I know that they're those patients, and there's so many patients to go around, but those patients are gonna choose that physician for that specific reason. They feel comfortable with that provider. Where for me, yeah, it's more about us promoting this. This is why I wanted to do this, is promoting the DPC system, and I see it as a amazing solution for both the patients and the physicians to practice medicine the right way and in a much more pleasurable way. And so I'm all for a million DPCs opening up.
Love it. Now, earlier you spoke about how even with the consultants that you have, it's all about funneling to membership. And so who have been the avatars of your practice? Who has joined?
Yeah. So I'd say I definitely have a good amount of patients who followed me from my corporate practice. And then those people kind of through word of mouth have told other patients who have joined as well. And then definitely some off of social media have found me. I'd say that my weight loss stuff has been a great funnel to my practice. I'd say most of my patients I'm funneling to my consultants. I wouldn't say that the consultants are bringing me much patients. And then I've been going around to kind of explain DPC to all the specialists in the area. And so I've gone in through referrals, mostly patients who are just looking for a good primary care doc. And so, yeah, that's kind of the hard part, is figuring out which lever to be pushing and knowing what's going to bring patients to the clinic. But yeah, it's been fun and very creative. You get to be just so creative with all of this stuff, and you see what's working, and if it doesn't work, you start to pivot right away. So it's trial and error for sure.
Love it. And let me ask you there, because other people are living this life of needing to do the same things that you've done in terms of specialists in particular. What tips do you have for those people in terms of like cold calling, showing up in office with baskets of goodies that people actually like and use? What are your tips on how to make connections with specialists, even if you don't know them from like residency, say?
Absolutely. Yeah. So what I did is I had my virtual medical assistant just literally cold call all the like specialists and around my area and said, "Hey, Dr. Schwegman wants to drop in, just say hi." And I just go say hi, drop some cards off. I explain to them what I'm doing. And yeah, it's been through that way promoting my weight loss. A lot of physicians don't want to deal with weight loss. And so I've gotten some great weight loss referrals from those docs. And then I think I make those patients happy. Those patients then go back to their specialist and they tell the specialist, "Oh my God, he's great." And so I have some specialists who are really cool and really have loved what I've been doing. And also what I think the specialists appreciate is I'm much more involved. And so I text them and I deal with all the kind of ins and outs of the patient. So I have this unfortunate case where one of my patients just has a lot of rheumatologic stuff going on, and they're constantly playing with her biologics and prednisone and all this stuff, and she gets all these side effects of these things, and I'm just managing all that day-to-day stuff, and I make their life so much easier because they don't need to be the ones involved micromanaging everything. I'm being the primary care doc that I'm supposed to be, and kind of helping manage everything and coordinating. And so it's crazy. Just I think the specialists appreciate the coordination is so much better. I had one patient who had pretty much an acute coli, and I was able to outpatient manage that, get him to coordinate with the surgeon, the GI, all this stuff, outpatient, and get him an MRCP right away. Like it was crazy what I was able to do on the outpatient basis. And the surgeon said, well, I have better OR availability at this hospital. So I'm like, okay, go to that one. And oh, that one's in your network. Cool. So we're going to go for, you just get to put all the pieces in place for that patient. And he didn't have to go to just some OR and just be some random case. The surgeon was ready. The GI was available. Everything was just like, boom, boom, boom. We got it all done. And it's just cool. It's cool coordinating things. It's cool being available to my patients, and just yeah, you get to really be there for them every step of the way. Yeah.
I think this is why it's so hard, especially when you're starting out, to really tell people about what TPC is, because you're like, literally, I just get to be a doctor.
Exactly.
You didn't have to code for any of that. I mean, yes, you still take Medicare, fine, but you didn't have to code. Even in
No.
Medicare, I called this surgeon. I don't
Yeah.
know what code that is, but I have to share here. I'm just dying over here, like nodding my head, because this is crazy. We live 45 minutes from the nearest hematologist oncologist, and my patient had a significant drop in their hemoglobin, worried about cancer. 3 trips to this oncologist, driving over there, including the last one in a foot and a half of snow with down power lines, down trees. And these are like my older patients, right? So they get there, and each time, all 3 times, I'm sorry, your appointment's been canceled. It's, could you have told these people by phone, by
Yeah, it's
text,
so
maybe? No.
sad.
And then we lost power, same patients, but we lost power. I'm standing in front of my fireplace because we have no electricity, but I have cell phone reception. And I'm literally like texting Dr. Laura Kinney, who's oncology in Missouri, who is telling me who to contact in California. So I'm getting numbers, I'm getting emails, and I'm like in front of my fire. My kids and my husband are shoveling snow outside. And I'm like, okay, great. I'm going to text this person, email this person. Within the same day, I'm like, okay, we've coordinated your oncology appointment at this
Mm,
tertiary center. This is the fax. This is who to send it to. This is how to follow up. And I had my virtual assistant in the Philippines who did have
exactly.
phone capabilities, like calling people. It's just insulting how this is how easy it can be in terms of
Yeah.
reducing barriers. I mean, that doesn't
And the
solve like,
quality is just
yeah,
insane. It's just simple things to make quality so much better.
yeah. And so this brings me to my next question, because one of the things also that I picked up on is that your wife is also a physician. So, like, we are a 2 physician household, my husband and I. And my husband was in fee for service, and I was still getting irritated with him because he was still doing all the things that we all did in fee for service, especially after we had kids. So, the question that I want to ask is, has your wife thought about doing DPC? And if so or not, why?
Yeah, absolutely. So she's kind of set up where she's not doing full time, and so and her corporate practice is a lot more flexible. I would say the corporation I was a part of was very strict in everything. And so for us, and she's pretty happy, kind of she gets to get out when she needs to. She gets to there are benefits to the corporate model where you check out and you have a million people covering you, and you don't have to be on 24/7, where I am kind of on 24/7 for my patients. There are boundaries that I've created, but overall, my patients can get a hold of me at any hour. So, and then the financial aspect. So definitely we're a lot more stable with her working over there. She definitely sees how happy I am practicing the way I am, and whenever her corporate model starts to, there they do very things somewhat differently than what I was a part of, but as they do kind of start creeping in their corporate kind of ways, I'm like, see, that's just another step they're taking to kind of control you a little bit more. So she sees it all and she's learning a lot about it. But yeah, at the moment, she's not going to jump ship anytime soon. I don't think and I think for us, that stability and then having coverage and all these things that we have to think about to it just it's a lot easier for us to be kind of separate at this point, but who knows what will happen down the line.
Who knows indeed. Not to wish this upon your wife or any physician, but we were in the same boat, totally comfortable in husband bringing in some money regularly as I was building DPC, and then he lost his job to a non-physician model when they eliminated the role of having a physician at the clinic. So it's like you said, nothing is guaranteed. And so I think it's very cool though that you have this business that is your own. And so if she ever were to need to or to want to, you would have already paved the road for her if she wished to join you.
Yeah, and I'm a big fan of diversification. So you never know what's going to happen with DPC. One day they might just create some rule and we're all kind of out there trying to figure it out at that point, or her corporation decides, hey, we don't need you. We got all these other professionals who can take your spot and we're going to kick you out. So it's kind of good to have both of those sides.
And Dr. Michelle Little said, you don't lose your doctor, your MD, DO at the end of the day, even if your DPC is not what you end up doing in 5-10 years. So
exactly. Yeah. And yeah, you get more comfortable with the idea of the world is my oyster. I can do whatever. There's so many opportunities out there, whether it's clinical or non-clinical. And we're all physicians. We've made it this far and we're so resilient and we've been through hard times and easy times and all this stuff. And whatever it is, we always figure it out. We're just those type of people.
So for those people who are listening and they're on the fence, they're not necessarily convinced one way or the other to stay in corporate or to do DPC, what would be your top tips for those people to have them evaluate their own lives through the lens of these particular tips that you're suggesting?
Yeah, absolutely. So by no means is DPC easy, I don't think. You got to be prepared for it. It's a lot of work, but if you enjoy it, if you like to be creative and create a practice however you want to create it, then this is definitely, if you're miserable in the current system, this is a great way to continue to practice medicine, enjoy what you do and be creative in what you're doing. And you don't even have to open up your own. There's like other practices that are hiring. And so if you hate the business aspect of it, go find a DPC that's hiring. There's a lot out there, I think, that'd be more than happy to bring you on. And so it's doable. I would say if you're looking for a different way of doing medicine, then it's right for you. If you're miserable, if you're burning out, I hate how some people, other docs, they'll kind of you kind of feel this insecurity. Oh my God, but I'm going to be seeing less patients, and so I'm contributing to the shortage of physicians. But I think that we're bringing more physicians, we're keeping more physicians in practice, and providing a different level of care. And we will be creative and let the private sector figure out how we're going to take care of all these patients rather than this corporatized model that is just putting a Band-Aid on a big problem. So if you're miserable in your system, you're burning out, and you want to stay in clinical medicine, this is an amazing opportunity to do things differently and bring back your joy of medicine.
Thank you so much, Dr. Shukman, for joining us today.
Yeah, thank you for having me, and thank you for all that you do. I think I do hope that DPC grows. I hope doctors continue to get happier and enjoy practicing medicine again. And that I think direct primary care is an amazing way, an amazing wave at the moment that hopefully will solve a lot of the healthcare problems.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community.
Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC News on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.